Gil. My name is Mackenzie. I'm going to be your nurse today. Today we're going to do an assessment of your musculoskeletal system, your urinary system, neurological system, lower extremities, and your abdomen. Can you tell me why you came in today?
I have chronic back pain.
Okay. How long have you had it?
6 months.
Where is it located?
My lower back.
Are you taking anything for it?
I have a prescription for oxycodone, but with acetaminophen, but I can't take it because I can't work with it.
This is important to note because the patient suffers with chronic back pain. We're going to need to do something to at least lower his pain, such as suggesting non-pharmacological methods he can use while he is at work, when he cannot take his pain medicine. So first we're going to begin by assessing the patient's musculoskeletal system. To do this, we might do things such as test his grip strength. So if you take my hands, and I'm going to have you grab it equally, I'll make sure that the patient is squeezing my hands equally to test that he is equal on both sides. I might have him push and pull against my hands. I might have him make arm movements like this so I can see how his joint is working. While I'm at it, I'm also going to assess his back since it's the main reason that he came in today. So can you sit for him? I might press on his back to figure out exactly where it hurts. It hurts right there. And then I might look at it to make sure it's not discolored or if there's any abnormal growths in it or anything like that. And next we're going to do is neurologic system, which you've already seen in one of our previous videos. But I'm going to ask my patient where you're at.
Hospital.
What day is today?
July 28th, 2019.
Who's the president?
Donald Trump.
Do you know when your birthday was?
It's January 13th, 1967.
These 4 questions assess his basic cognitive status. So it's going to tell us that he's alert and oriented to keep answering the question. Also, to assess his neurological status, we might do other things such as a mental test, any kind of mental games. You might do things such as looking at the way he walks and things of that nature. Next, we're going to assess his abdomen. To do this, we want to listen to his abdomen in all 4 quadrants to assess his bowel sounds. So I'm going to show you right now. I'm going to look at your shirt. It won't hurt. It's important that bowel sounds are noted within 3 seconds of when you listen to them. Anything longer could show that he has a hypoactive bowel. If you have them shorter than a second apart, it could show that he has a hyperactive bowel, which is also not great. You also may want to press on his abdomen to feel if it hurts him anywhere. You want to feel for tenderness, softness, anything abnormal you're trying to feel for. Next, we're going to assess his urinary system. You have a patient in a hospital, and one of his main complaints are with his urinary system, which is not our patient's main concern today. You may want to actually take a look at his parts down there. But since this is not our patient's main concern, we might ask him questions like how frequently he visits the bathroom every day, and how often do you have a bowel movement.
2 times a day.
You might want to do things such as palpate his bladder. Just located right here. Asking about how many times he goes to the bathroom checks his kidney functions, which is an important part of the urinary system. Next, we're going to assess his lower extremities. First off, you might want to check his popliteal pulses, which are located behind his legs, which you can't see with you. And then you also want to ask your patient to slip off their shoes.
Both of them.
Yeah. And so whenever you have your patient's foot, you want to assess the ability to push towards my hand and pull against it. That also helps to assess his musculoskeletal system. I would normally have the patient take off his socks and I would feel for his calf refills. And then you want to assess how he bends his leg, which he does fine. And after all that, we might suggest to our patient things to do about his chronic back pain, such as dimming the lights when it really starts to hurt, playing soft music, putting ice or heat on it, maybe using another source of medication such as icy hot or biofreeze on it, and that's it. So today we've assessed his musculoskeletal system, his urinary system, his neurologic system, his lower extremities, and his abdomen. Thank you.